Collagen is the most abundant structural protein in the human body. Think of it as the primary building block for your connective tissues, including your skin, joints, bones, tendons, and ligaments. In fact, it makes up about 25 to 30% of the total protein content in your body. At the molecular level, collagen is a long, fibrous protein that's made up of amino acids, primarily glycine, proline, and hydroxyproline. These amino acids are tightly woven together to form a triple helix structure, which is unique to collagen. This structure is like a twisted rope, giving collagen its strength and flexibility. Each collagen molecule is made up of 3 polypeptide chains, each coiled into a right-handed helix. When these chains bond together, they form the characteristic triple helix structure, which is both stable and resilient. Collagen fibers themselves are highly organized into larger bundles, which form a network of connective tissue throughout the body. These fibers are responsible for supporting the structure and integrity of tissues, from the dermis of the skin to the cartilage in our joints. Collagen isn't just one protein. It's actually made up of over 28 different types, with the 4 most common ones being type 1, 2, 3, and 4. Type 1 collagen is the most abundant type in your body, making up about 90% of the collagen found in your skin, bones, tendons, and organs. In your skin, type 1 collagen is responsible for maintaining its elasticity and firmness, helping resist wrinkles and sagging. In bones, it provides the framework that gives them their strength, while in tendons, it ensures they can withstand tension. Next is type 2 collagen, which is found primarily in cartilage, which is the flexible tissue that cushions your joints. This type of collagen is crucial for the elasticity and smooth movement of your joints, helping to absorb shock and reduce friction between bones. Type 3 collagen is found in the skin, blood vessels, and internal organs. It is often found alongside type 1 collagen, providing structural support to the skin and strengthening the walls of blood vessels. It also plays a role in making your skin look young, healthy, firm, and smooth. Over time, the amount of type 3 collagen decreases, contributing to the visible signs of aging. Finally, we have type 4 collagen, which is a bit different. It's not found in fibrous tissues like the other types, but rather in the basement membrane, which is a thin layer that supports the cells in your skin, kidneys, and lungs. It plays an important role in the filtration of kidneys and other organs. Types 5 to 28 either play smaller, more specific roles in the body, or they assist with either of the main 4 types in their function. The food you consume plays a key role in collagen production. Foods that are high in vitamin C, amino acids from protein-rich sources, copper, and bone broth are all essential for collagen synthesis. While type 4 collagen isn't directly found in food, many foods are vital for its production, as well as the creation of other collagen types. If you include these foods in your diet, you likely won't need to consider collagen supplements unless you're seeking a specific benefit, which we'll cover later in this video. By this point, we now know what collagen is and what it is used for. But what is collagen supplementation and where does it come from? Looking at a brief history of collagen supplements, they have actually been around for a long time. The first reports of using collagen was for wound healing in ancient Egypt and Greece, where materials such as honey, silk, and lint were used for wound management. However, the collagen molecule was discovered in 1930 and started being extracted first from fish in the 1980s. The first collagen powder that we are familiar with today was shipped in 2010, which brings us to the modern day supplementation, in which collagen molecules are seen in many different forms. To understand modern day collagen supplementation further, we need to understand where they come from and what types are available. Type 1 sources include bovine, found in skin, bones, tendons, and ligaments of cows; marine, extracted from fish skin, scales, and bones; and porcine, found in skin and bones of pigs. Type 2 collagen, we have chicken, extracted from chicken cartilage, especially from the sternum; and bovine, also found in cartilage, although much less commonly used compared to chicken. For type 3, it's found in bovine, extracted from skin, bones, and blood vessels; porcine, found in skin and internal organs; and chicken, present in cartilage and tissues. For type 4, it's not typically extracted from animals. However, as previously mentioned, vitamin C, amino acid, and copper ingestion can help with building type 4 collagen in cells. Now we're going to look at the different forms that collagen comes in. First is collagen powder, which is a popular collagen supplement usually hydrolyzed, which means it is broken down into smaller peptides for easier absorption. The benefits are that it is easy to mix into drinks such as smoothies, coffee, or water. Also, it often contains type 1, 2, and 3 collagen. Next is collagen capsules or tablets. These are very similar to collagen powder as they contain the same hydrolyzed collagen but just in pill form. This makes it ideal for those who prefer not to mix powders into liquids or who want a more controlled dosage. Dosage is something we'll talk about later in this video. Another form is ready-to-drink collagen liquid. This can be absorbed quickly, with some products containing additional vitamins and minerals such as vitamin C or hyaluronic acid. Vitamin C helps with collagen synthesis, and due to it being a powerful antioxidant, it helps protect collagen from free radicals that can damage it. Hyaluronic acid helps hydrate and support collagen, enhances skin elasticity, lubricates joints, and stimulates natural collagen production. These products typically contain type 1 and 3 collagen, with type 2 being less common. Lastly is collagen-infused products, such as creams, lotions, and serums. These are advertised to promote skin hydration, elasticity, and anti-aging effects. However, some literature questions the ability of topical collagen to effectively penetrate the skin and have the same effects as the other oral forms. The extent of this will be covered in more detail later on. These products also typically contain type 1 and 3 collagen. An important point to be aware of is that the bioavailability of collagen greatly depends on whether it is hydrolyzed. Bioavailability is defined as how easily a substance is absorbed or used by the body. Being hydrolyzed, as previously mentioned, is when a substance is broken down into smaller peptides which are easier to absorb. It is also important to note that while it is possible to boost collagen synthesis naturally through diet, research shows that the bioavailability from food sources is relatively low and less effective compared to supplementation. By this point in the video, you should hopefully have a good understanding of collagen supplementation. However, what are the benefits and does it really live up to the marketing hype? The first benefit that the media presents is the effects on skin health, with social media, articles, and companies claiming that these products hydrate, reduce wrinkles and aging, and generally improve overall skin health. To see if these claims are true, we're going to have to look at what the literature actually says. When looking at the literature, the sources generally present consistent positive outcomes for hydrolyzed collagen, improving various aspects of skin health. In fact, multiple randomized controlled trials and meta-analyses report a statistically significant improvement in anti-aging, skin hydration, and elasticity compared to placebo groups. One of these papers, a meta-analysis of over 1,100 people taking collagen, found that taking collagen orally for 90 days was effective in reducing skin aging by removing wrinkles, improving skin elasticity, and hydration. The effect sizes for both groups were moderate and shown on the screen. Another paper suggests that oral ingestion of collagen peptides improves collagen density in the skin by 12 to 19%, indicating increased formation of new collagen fibers. While some studies focus on specific sources like marine collagen, hydrolyzed chicken sternal cartilage extract, or bovine collagen peptides, the overall evidence suggests that hydrolyzed collagen from various sources can promote beneficial effects on the skin. A meta-analysis indicated that the effects of hydrolyzed collagen on skin hydration varied based on the source, with marine collagen seeing the best results, then bovine, and then chicken. However, for skin elasticity, there was no significant difference in the effects of different sources. The reviews on the benefits of skin health are mostly positive, which include smoother skin and a reduction in wrinkles. One review did claim to have experienced inflamed skin after a week of use. However, it could be a result of the other products that were applied to the skin. On the whole, oral ingestion has been shown to be more effective than topical application due to the limited penetration of the skin, which is influenced by the high molecular weight of the substance. While supplementing with collagen for skin health benefits sounds very good, studies often use different types of doses, which makes it very hard to make general recommendations. The best estimate from this meta-analysis showed that benefits were observed with 2.5 grams of oral supplementation of collagen peptides or hydrolyzed collagen for 90 days. And if you really want to maximize the benefits, make sure your collagen is from a marine source. The second benefit is joint health. The current claims around this benefit include a reduction in joint pain and improved symptoms of osteoarthritis. The current body of evidence suggests that collagen supplementation, particularly with hydrolyzed collagen and collagen peptides, support these claims. Literature also indicates benefits in activity-related joint discomfort in athletes, as after collagen supplementation, the use of alternative therapy is reduced by 59%. Studies also indicate collagen supplementation can potentially accelerate recovery from injuries. Reviews overwhelmingly support this, claiming that joint pain has reduced, especially in knees, hands, and for people with osteoarthritis. A meta-analysis of randomized control trials provides support for these findings. However, it's important to acknowledge that the evidence is not uniformly strong across all studies, and there are limitations in existing research, such as variations in study design, dosage, and participant populations. It is also important to note that whilst literature is mixed, it provides a recommendation that the dosage required to see benefits in joint health are between 5 to 10 grams, which is over 2 times more than for skin health. So it is important to know what you are taking it for to determine the dosage needed. It is also advised to take it for at least 3 months consistently to see benefits. In terms of the best source and form to take for joint health benefits, it comes down to personal preference as to whether you go for bovine, marine, or porcine, as they are shown to be equally beneficial in this case. As long as the collagen is hydrolyzed, you are good to go. As an additional point, some research suggests undenatured type 2 collagen may be a viable alternative, especially for knee osteoarthritis, at a much lower dosage of around 40 milligrams per day for 90 days. This saw improvements of 20%. Despite the benefits stated, some medical professionals, such as Dr. Zalzal from the Talking with Docs YouTube channel, are skeptical and voices the idea that collagen supplementation is most likely just a placebo, as the benefits show marginal differences, ones that someone cannot feel, for example, 7% less joint pain when taking collagen. However, the counter-argument is that if taking collagen is just a placebo, it may still be worth taking if it's going to feel like it's helping, even just by a small margin, especially when collagen has no documented side effects. This decision is ultimately up to you to decide. The next benefits are to tendons, ligaments, and tissue repair. Literature on the benefits for tendons and ligaments is fairly new, and there is a few areas that need further investigation. However, some sources do provide evidence that collagen supplementation is beneficial. One study demonstrated that specific collagen peptides significantly increased RNA expression and biosynthesis of collagen type 1, collagen type 3, and elastin in both ligament fibroblasts and Achilles tendon cells. The same study found that collagen supplementation increased the tensile load, stiffness, and ultimate tensile strength of ligaments, as well as potentially improved tendon and ligament health. It also confirmed that collagen peptide administration, alongside an intermittent mechanical loading protocol, elevated the biosynthesis of collagen, suggesting it may be crucial in injury prevention and tissue repair. Another study also suggested improved tissue repair, as it found that there was increased collagen synthesis and elevation for 72 hours with 15 grams a day of collagen enriched with vitamin C. This could mean collagen supplementation can assist in injury rehabilitation. In support of this idea, Keith Barr, who is a physiotherapist at the University of California, found that giving injured athletes collagen for ACL injuries helps strengthen their ligaments and rehabilitate the athlete. Although exciting news, these studies are yet to be put to the test in a full clinical trial. Due to the limited current knowledge on this topic, optimal sources and forms are also unknown. And with regards to consumer reviews for this benefit, it is hard to notice a difference in tendons and ligaments, resulting in few reviews around this area. The next benefit is muscle health. Current research suggests that low molecular weight hydrolyzed collagen paired with resistance training may improve muscle mass, strength, recovery, soreness, force production, and help reduce muscle stress and inflammation in certain groups. The review on these benefits overwhelmingly agree on reduced muscle soreness as a benefit. However, there are little reviews on the others. A study on elderly sarcopenic men found that combining resistance training with 15 grams a day of collagen peptides led to 4.2 kilogram gain in fat-free mass, 45% more than the placebo group, and 126% greater increase in quadriceps strength. However, other research suggests higher quality proteins like whey may be more effective for muscle protein synthesis and hypertrophy. In addition, it's crucial to note that these improvements are specific to the conditions and population studied in those trials. A systematic review highlighted that changes in body composition and strength with 15 grams a day of collagen and resistance training were not as prominent in recreationally active participants as they were in the elderly sarcopenic men. While the percentages suggest potential benefits, it's not accurate to give one overall improvement rate for muscle health from collagen. Results vary depending on specific outcome and context. Research also shows inconsistencies, especially around how collagen works, whether it's better than other proteins for muscle growth, and the best way to use it. In summary, low molecular weight collagen peptides, especially hydrolyzed or marine collagen, are best for muscle health due to their better absorption. A higher dose of 15 grams a day with resistance training may boost muscle mass and strength, while 5 to 10 grams a day can aid joint comfort and recovery. Pairing collagen with vitamin C and other quality proteins may enhance results depending on the individual needs. The next benefit is wound healing. The reviewed paper suggests that collagen supplementation, both oral and topical, holds promise for enhancing wound healing. Oral hydrolyzed collagen and collagen peptides derived from jellyfish and chum salmon skin may provide essential amino acids and stimulate fibroblasts for tissue repair, while topical dressings can support healing by delivering collagen directly to wounds. However, more high-quality human trials are needed to determine the best types, doses, and forms for different wounds, and to compare collagen's effectiveness with standard treatments. Promising animal studies highlight the need for further research in humans. There are also very limited reviews of collagen for wound healing. Benefits of collagen on gut health, hair, and nails has also been claimed. However, research on collagen's effect on gut health, hair, and nails is limited and lacks strong evidence. While some users report softer hair and stronger nails, others see no change. Results are mixed, and more reliable alternatives may exist. Ultimately, it's a personal choice whether you try it. Another benefit is for postmenopausal women. As estrogen declines after menopause, skin becomes thinner, drier, and less elastic. Studies on postmenopausal women show that collagen peptides can help by improving skin hydration, elasticity, and dermal collagen density. Estrogen decline also affects bone density, as it can lead to osteopenia and osteoporosis. However, taking collagen has been shown to improve bone mineral density, which counteracts the effects of estrogen reduction. This evidence shows that for postmenopausal women, collagen supplementation could be something to consider. From the literature, 5 to 10 grams of hydrolyzed type 1 or 3 collagen will result in these benefits. These benefits are also supported by many consumer reviews. Due to the increased attention collagen supplementation has received over recent years, there have been many misconceptions, creating myths. Myth 1 being that plant-based collagen is superior to other sources. It has actually been shown that the body cannot synthesize collagen from plant-based sources. While plant-based sources can provide amino acids that contribute to collagen production, they don't provide collagen directly. The second is not directly related to collagen, but is a very common misconception. It's that supplements must be taken in a capsule form to get past the stomach acid. This is simply not true. In fact, capsule form is not a preferred way of taking collagen, as normally you can fit 500 milligrams into a capsule. And due to the recommended dosage being as much as 15 grams in some cases, you would have to take 30 capsules, which is very impractical. The third common myth is that dermatologic claims made in the media are backed by established scientific evidence. This review found that dermatological claims about collagen on social media often go beyond what current science supports, showing a clear gap between marketing and evidence. The key takeaway is don't fall for the hype. Many claims are exaggerated or based on limited research. That's why this video is valuable. It breaks down what the science actually says and helps you make informed choices, not just following marketing buzz. To conclude what has been said, there are 4 main benefits. One being skin health, as collagen supplementation, especially type 1 and type 3, is crucial for maintaining skin's firmness, elasticity, and hydration. Second is joint and bone health. Type 2 collagen supports cartilage, bones, ligaments, and tendons, helping maintain joint flexibility and reduce pain, especially in those with osteoarthritis or joint stress from activity. It also strengthens bones, lowering risk of fractures. Third is recovery from injuries. Collagen supplementation can speed up recovery from tendon and ligament injuries, enhancing tissue repair and collagen biosynthesis. It may also be beneficial for athletes, especially in terms of ACL rehabilitation and strengthening ligaments. Fourth is muscle health. Collagen peptides, especially when paired with resistance training, can boost muscle mass, strength, and recovery. This is particularly helpful for older adults with sarcopenia, where studies have shown notable improvements in both muscle mass and strength. With regards to how much to take, the recommended dosages for skin health, joint health, muscle health, tendons and ligaments, and postmenopausal women are all shown on the screen. All dosages are fine to be taken in any form as long as they're hydrolyzed. So, who should be taking collagen and what for? Individuals with skin concerns, people with joint pain, athletes or active individuals, older adults, and people recovering from injuries should all be taking collagen. Collagen supplementation, particularly hydrolyzed collagen, is safe, with no documented side effects. It is also very important to choose the right dosage depending on your specific health goals to achieve the desired benefits.